Hi, thanks so much for being here, and I'm so looking forward to presenting today. So I'm just going to present some recent findings from our poverty tracker that's examining the economic impacts of COVID-19 on life in New York City. Just a brief summary, our PIs are Erwin Garfinkel and Jane Waldvogel, and we have an amazing team of investigators and study staff, so I want to make sure we acknowledge them. So I'm going to begin by talking about what the poverty tracker is and what the poverty tracker was finding before the COVID-19 outbreak in New York City and across the country, as well as our plans for monitoring the economic impacts of the outbreak in the city going forward. You'll see that the poverty tracker is a unique tool that's well equipped to capture the economic challenges brought on by the pandemic and the role of the policy response that it has had in mitigating those impacts. So what is the poverty tracker? It's a longitudinal study tracking trends in poverty, material hardship, and health problems and general well-being in New York City. It was launched in 2012, and it's run through a partnership between the Columbia Population Research Center, the Center on Poverty and Social Policy, and Robin Hood, the city's largest poverty fighting organization. Now, one of our key objectives is to examine the dynamics of poverty and other forms of disadvantage over time and to understand what sustainably lifts people out of or pushes them into poverty in New York City. We do this using a representative sample of adult New Yorkers whom we interview quarterly over several years, 4 years in our current panel, collecting a wealth of longitudinal data. And our study has included several cohorts, beginning with a group of 2,000 adults whom we interviewed between 2012 and 2014. We then recruited a sample of roughly 4,000 whom we've interviewed between 2015 and early this year. And in 2017, we moved to a rotating panel design, and we recruited a refresher sample of roughly 900 respondents who entered the study in 2017, and we're currently recruiting our next refresher sample. We also have a special study of households with young children called the Early Childhood Poverty Tracker. That data is, those households are recruited when children are between the ages of 0 and 3, and they complete poverty tracker surveys. So as I said, we track trends in poverty and disadvantage using a series of surveys. Our first is an annual survey. And that's the survey that respondents complete when they enter the survey, and on it we collect data on our core measures of disadvantage. Those include income poverty, measured using the supplemental poverty measure, which I'll describe in a moment, as well as material hardship. It's a measure of acute inability to meet basic needs in one of 5 areas, including housing, food, utilities, financial hardships, and medical hardships. And then we also measure health problems, which we determine using a self-reported health indicator and indicator of disability status. So a quick note on the official poverty measure and the supplemental poverty measure. I hope people can see my slide over here. But the official poverty measure was developed in the 1960s and compared a family's total before tax cash income with a poverty line or a threshold. Now, the threshold was defined as 3 times the cost of a minimally adequate food budget at the time. And with the exception of some minor adjustments, this measure has only been updated annually to account for changes in inflation. But over time, this formula has become increasingly outdated, and a focus on before-tax cash income ignores many of the benefits that families receive through the tax system, such as the earned income tax credit, as well as non-cash forms of support such as food stamps and housing subsidies. And importantly, the official poverty measure is not, the line is not differentiated geographically to account for the cost of living. But the supplemental poverty measure improves on this measure on all of these fronts. So it's based on a contemporary spending on food as well as other necessities like clothing, shelter, and utilities. And the thresholds in places like New York City is higher, given that average housing costs in the city are higher. And in the tabulation of household resources used to determine poverty status, the supplemental poverty measure also accounts for taxes and in-kind transfers. So with it, we're actually able to evaluate the impact that these social policies are having on poverty. And so that's the measure that we use in the poverty tracker, is the supplemental poverty measure. Now, in between our annual surveys, we also administer quarterly surveys that collect information on other aspects of well-being, including but not limited to assets and debt, consumption patterns, work and employment, a very comprehensive study and questionnaire about health. So we have a wealth of data. The poverty tracker is also a nimble tool, so we can add survey modules in response to changes in the city, including policy changes like the expansion of the paid sick leave law in the city and the increase in the minimum wage. We can also ask questions about economic changes like those brought on by COVID-19. So I'm going to quickly summarize what we were finding before the COVID-19 outbreak, and then we'll turn to our current results where we're looking at the current impact of the outbreak on economic life in the city. So poverty and economic challenges were problems in New York City prior to COVID-19, though improving somewhat through since 2012. So these are the poverty rates among adults in the city from 2012 to 2018. And so the poverty rates fell from about 24% in 2012 to 20% in 2018. But still in 2018, 1 in 5 adult New Yorkers lived below the poverty threshold. And it is a significantly higher rate than the national rate of 12% and higher than the rate in other large metro areas in the country, which was about 16%. But we also know that public policies played a large role in reducing the poverty rate in the city. And like I said, the supplemental poverty measure allows us to examine these impacts. And here we can look at the impact that tax credits, nutrition programs, cash transfers, and housing subsidies had in reducing the poverty rate. So government programs, you can see, for example, housing subsidies reduced the poverty rate in the city by about 5%. And without any of these programs, the poverty rate in the city would have been about 31%. That's not featured here, but that's based on some other results. Also, as a longitudinal study, we can see the share of New Yorkers who lived in poverty in at least 1 year between 2012 and 2018. And here, the results show that about 50% of adults lived in the city lived in poverty in at least one of those years, meaning that New Yorkers are many New Yorkers are in vulnerable economic positions, and more than a single year snapshot of the poverty rate might suggest. The population in poverty is dynamic, and many people are vulnerable to falling below that line. As I said, the poverty tracker collects measures of material hardship or acute inability to meet basic needs in one area. And an example is having your utilities cut off or not being able to see a doctor because of cost. And we consider a respondent to have faced material hardship if they faced any one of these hardships. Like the poverty rate, rates of material hardship have declined since 2012, but still about 30% of New Yorkers faced one of these material hardships in 2018. Showing that many New Yorkers were in economically precarious positions prior to COVID, and COVID has only made this worse. So now I'll discuss our current research on the impacts of COVID-19 and plans for monitoring those impacts going forward, specifically these economic impacts. First, we're harnessing our pre-COVID-19 data to examine the impact that policies lawmakers are turning to at this time have had, for example, paid sick leave. We've also fielded a COVID-19 specific survey module in May and April 2020, and we're currently analyzing the results from this survey and have preliminary findings that I'll share with you today. We're also developing a second survey on the hardships that families endured for reasons related to COVID-19, as well as the support networks that they've turned to. And we also have some additional extensions in the research that I'll talk about. So to sum up over here is that we're looking at what we know, what we're seeing change, and what are the best ways to mitigate these challenges. So in terms of using the existing data that we have from prior to COVID-19, we have a wealth of data on various forms of income and various social policies in the poverty tracker data set. Since its inception, we've been monitoring the impacts of the New York City paid sick leave law, which provides employers with up to 40 hours of, or about 5 days of paid leave. But when we looked at the data, we found that, paid sick leave policies available to New Yorkers weren't necessarily covering all respondents, and that those who were economically vulnerable were least likely to be covered by these policies. So about 37% of workers who weren't covered by paid sick leave were poor, and 55 didn't have the cash available on hand to cover an emergency expense. So this brief explores the paid sick leave policies that were available to New Yorkers before and amidst the COVID-19 pandemic, and finds that many vulnerable New Yorkers are left out, putting their health and financial security at risk. We also, just as the outbreak took over life in New York City, developed and fielded a survey on its economic impacts. The survey module inquired about loss of work, layoffs, loss of work-related income, loss of employer-provided health insurance, as well as enrollment in unemployment and food stamps or SNAP, and a series of questions regarding material hardships. We were able to link these results to data collected on earlier surveys and identify the populations that have been hardest hit by the economic downturn associated with the COVID-19 pandemic in New York City. And here's some results from that analysis. So the dark blue bars represent the poverty rate prior to COVID-19. The turquoise is the share of a population that was considered low income, so living below 200% of the poverty line before COVID-19. And then the green is the share experiencing severe hardship prior to COVID-19. And we've disaggregated this among respondents who had lost work and those who have not lost work. And you can see that those who had lost work were significantly more likely to be in poverty before the outbreak, to be considered low income, and to have experienced severe hardship. So those workers who are enduring layoffs and work cuts and income losses were already in very difficult and precarious financial positions prior to the outbreak. We also find that 1 in 3 of our Black and Hispanic respondents who have lost work as a result of COVID-19 were in poverty prior to the outbreak, compared to 22% of our full sample of respondents who have lost work. So not only are groups that have been financially hard hit, we also see racial disparities within that impact. Now we're developing a second survey on the hardships that families endured for reasons related to COVID-19, as well as the supports that they have turned to. This survey is going to probably be fielded later in the summer, and it will examine changes in household composition, which we know are been very common in this, where families, people moving into households or moving out of households because of financial constraints, as well as just need to share in caretaking responsibilities and responsibilities of caring for children and other household members. But we're also going to look at the financial and instrumental needs and supports that families have turned to in this time. So this will include a comprehensive understanding of food, housing, utilities, internet and cell phone service needs, as well as health-related needs, including mental health and cash-related needs. We'll also inquire about SNAP and food pantry and unemployment use, and the use of cash stimulus payments. So we'll both understand the needs of New Yorkers, as well as the social policies and networks that they've turned to in this time. These results will be very useful to those looking to identify the best methods for providing support and assistance to those who are suffering economically due to the pandemic, and identifying the people, places, and resources that they're turning to, as well as gaps in accessibility. Oh, and one additional note, I also wanted to say that we've started to measure changes in material hardship.
Sophie, 2 minutes.
2 minutes, okay. And have noticed that there's been a significant increase in food hardship in the city associated with the outbreak. So I just wanted to note that. I also want to note about, discuss quickly some additional extensions to our research. We plan on running a qualitative study on poverty tracker participants who have lost income or employment as a consequence of COVID-19. And this will include a baseline interview and follow-ups similarly to our core study is a longitudinal quantitative study. This will be a longitudinal qualitative study. And it will focus on the financial conditions before the COVID-19 outbreak, the immediate economic impacts of the outbreak, and the strategies used to regain stability and help that is still needed. Earlier, I mentioned that we have a panel cohort that completed their poverty tracker surveys earlier this year. We hope to, if possible, follow up with this panel to collect more information from them, as we have about 4 years of prior data on them. And then we're also developing a module on housing insecurity and health, including healthcare needs, access and utilization, that will provide more information about health and housing at this time. So to sum up, the Poverty Tracker is a unique tool well equipped to capture the economic challenges brought on by the pandemic and the role that the policy response has had in mitigating that impact. We've already documented that those who have been hardest hit were those already facing economic challenges, and we'll further unpack these consequences in our follow-up work. We'll also look at the coping strategies that New Yorkers use, the networks of support that they turn to, and the government response. So thanks so much for your time, and I look forward to any questions.
Sophie, thank you for that shocking presentation. Please unshare so Jose can share his talk. I have a question to lead things off. Do you have any data on the impact of the poverty on access to testing, COVID-19 testing, and PPE?
We don't, but that's a fabulous question. And like I said, we're developing that standalone survey that will field, and I think we should definitely add that kind of question. We do have a question about testing that we're, if you have been tested, but not necessarily the access to testing. So we can definitely develop that and love to send you a copy for any review if you have some comments.
The other question I have is compared to other countries or cities where the death rates have been much lower. So for example, South Korea or in the United States, San Francisco, do you have any data on differences in poverty incidence between those locations? And New York?
Go ahead. For example, for San Francisco, I know that a similar study to the Poverty Tracker was developed to monitor poverty in the San Francisco and the Bay Area. And so we can coordinate with them to see how to get a similar measure to ours, like I was saying, that supplemental poverty measure, and compare estimates. But we also can investigate differences based on kind of other poverty measures that they might have in places like South Korea and compare impacts. That's a great question.
Suzanne Bacon, if you unmute yourself, you can ask a question. Suzanne? Yeah.
Yes, thank you, Sophie. This was terrific. Could you let me know whether or not you have your findings by geocode, census tract, zip codes, that kind of thing?
We have our, like I said, we have a panel of about 4,000 respondents, and we have that all geocoded. We also have, we do geocode all of our data. If you would like the access to the geocoded data, we have like a secure data contract that we develop, but any researchers who are interested in downloading should definitely reach out, and we can figure out how to make that happen.
Thank you, will do.
Margaret, if you unmute yourself, you can ask a question.
Hi, Sophie. Thank you so much for a wonderful talk. I'm wondering, are you finding in your data, or have you all looked at this at all, are you finding secondary, any kind of rise in secondary deaths? In other words, not necessarily related to COVID-19, but because of COVID-19, still people are delaying other forms of healthcare?
That's another great question. We are going to add questions about access to healthcare and foregoing, routine medical procedures in our follow-up survey. And we'll make sure, we've asked about any deaths related, death within people's networks related to COVID, but we could also ask about these like secondary deaths. And that's a great question and would be really interesting and important information.
Great, thank you so much.
If I could ask a question really quickly, this is Eric.
Yeah, sure.
I'm wondering if the poverty tracker is capturing information on the children of the respondents, and in particular, I wanted to know whether children are increase food hardship due to loss of school lunches, or are the programs the city is trying to put in place to replace that, are they effective?
That's an excellent question. So far, we've noticed an increase in food hardship generally, about a 30% increase among those who have lost work. We're thinking through how to add questions about food hardship specific to children as opposed to the household more broadly, and would be able to kind of answer that question with those responses. In terms of like mitigating the impact, that will also come up on our follow-up survey, where we ask about those types of services received, as well as how able families were to purchase sufficient food using, the income from these newer policies implemented by the city and federal government.
Thank you.
Thank you again, Sophie.